Beverly Hills, land of the rich, home of the famous. Sure, the stereotypes exist, but what most people don't know is the truth behind the plastic. If there is anything I have learned in all my years as a plastic surgeon, it's that appearances are not always as they seem. I get patients from all over the world, from celebrities to the average everyday housewife. But there is one thing they all have in common. Everyone needs a lift. Welcome to my world.
My name is Melissa and I'm 29 years old. I was born in Argentina, and when I was 20 years old I had a breast augmentation, but I wish I would have gone a little bit bigger. And I'm about to turn 30 this year, and I feel like it's a great time in my life to make the changes that I've been wanting to. So I'm going to go a cup size bigger, and I'm going to have some body sculpting. I was really nervous about finding a good doctor to do the work. Then I heard 3 of my friends had done some work with Dr. Kasabian, and I've seen the results and they look great. I'm really excited about meeting Dr. Kasabian and seeing my results. I've been looking forward to this for a while, and now that I've found the right doctor, I can't wait to make this change in my life.
I'm meeting with Melissa today to discuss some concerns she has about her body. I'm not sure about the specifics, but let's find out. Hi, Melissa.
Hi, Dr. Kasabian.
Nice to meet you.
Likewise.
What brings you in today?
I had a breast augmentation when I was 20 years old, and I'm about to turn 30, and I want to go up a few sizes, so I'm excited about that. And I also was thinking about maybe doing some liposculpturing.
Okay.
And I also feel like I'm getting a little bit flat in the back, and so I wanted to see what my options were there.
All right. So you had surgery when you were 20 years old, breast augmentation. What cup size were you before the surgery?
An A.
An A. And now you're what cup size?
I want to say a small C.
Small C. And you want to be what when you're done with this procedure?
A D.
A D. Okay. That's fair. And then liposuction, which area are you concerned about?
My sides, my hips, and my thighs.
Yeah.
That's my main concern.
Okay. That's very common for women. It's usually the waist, the lower abdomen, and the thighs, the inside and outside, and sometimes the knees. Is the knee a concern?
No, not so much.
Okay, that's fine. Yeah, that's the typical pattern for women. Men, it's more like upper body, like chest and abdomen and waist. But women, it's more lower. So that's typical. Losing volume in the butt area, that's a common thing where it's not looking as the same as when you were a teenager. So it's a good time to bring it up, because the fat that I'm gonna be getting out during the liposuction, I can use that to augment your buttock, and so that it looks like you have a butt lift, and gives you that shape that you had when you're younger. Yeah. So when you combine the liposuction of the waist and the fat injection to the buttock area, the two together gives you that heart-shaped butt look that everybody wants. All right. So next we'll do some sizing. I have a special machine. It does a scan of your chest, and we'll put it in, and we'll see what a D will look like. And we can also test with actual implants, and you'll see for yourself on your body how a D will look like.
Perfect.
All right. So let's go to the next room then.
Okay, thank you.
We'll go ahead and just open your throat.
I'm adding 2 things.
Okay, Melissa, so with these implants stacked on top of yours, you'll achieve a D. Okay? So let's slide this in. Just to give you a better feel of what you'll look like. What does it feel like?
Feels great.
Looks really nice.
I can't wait.
I think the size is perfect.
I think so too.
All right, Melissa, so we did the simulation and the sizing, and D cup looks good on you. I think you were happy with that.
Perfect.
Yeah, and reviewed the areas of liposuction. We're going to do liposuction of your abdomen, your waist, and the thighs. And the fat that I'm going to be harvesting from the liposuction, that goes in to give you that Brazilian butt lift.
Yes.
All right, so the combination of the two, you look fantastic. Any questions for me?
No, I think you answered all my questions. I'm just really excited now.
Fantastic. I'm excited too. So next, one of the patient coordinators is going to help you choose a date that's convenient for you, and we'll proceed.
Perfect.
All right? So nice to meet you.
Thank you. I just had my consultation with Dr. Kasabian and we decided which procedures I'm going to go with. I'm going to do the breast augmentation and increase my size to a D cup. I'm going to do the liposuction on the inner and outer thighs, on my abdomen areas, and I'm going to do the Brazilian butt lift. I'm so excited, I just can't wait.
I just met with Melisa. Melisa had the previous breast augmentation. The implants were placed over the muscle. She doesn't like the look of them because you can see rippling and the contour of the implants. This can be easily taken care of by replacing it with a new implant that's placed under the pectoralis muscle. This will give her a more natural look and less rippling. And at the same time, she wants to go up a little bit in the size because the size she has is not enough. And I agree with her before, because for her height, her shoulders and her hips, she does need a little bit larger implants to match her curves. Also, she had some concerns about her body figure. Concern areas are her waist, her abdomen, and the thighs. What I'm suggested for her is liposuction in those areas. Her other concern was her buttocks being flat. An option here, which we're gonna consider, is the fat injection, the fat that's harvested from the liposuction injected into the buttock area. And that will augment her buttocks. So when you combine the breast augmentation with the fat injection in the buttocks, plus sculpting her waist, abdomen, and thighs, all in all, her figure is gonna be very much improved, and I'm sure this is gonna make her very happy.
Today is my surgery day and I'm really excited. I can't wait to see how my results turn out.
Good morning, Melisa.
Good morning.
How are you doing? Okay, today's the day.
Yes, I'm excited.
Okay, so we're gonna start with liposuction, doing you the abdomen, the waist, the thighs, outer thighs, inner thighs, the back area, and the fat that I'm gonna get, I'm gonna put it in your butt, the upper butt, to give you that Brazilian look and the curves you've always wanted.
Yes.
All right, and also you had the implants before, but they're too small. D would look very nice on you because you're tall, you've got the shoulders and the hips to match it, so you're gonna be looking great, fantastic.
Wonderful.
Okay, do you have any further questions?
I think I'm okay.
Okay, then we'll go ahead and start. Happy thoughts. Alright. Today's Melisa's surgery, I'm going to be doing liposculpturing of her abdomen, waist, and her thighs. The fat that's going to be harvested, it will be processed and injected into her buttock area. She had breast augmentation years ago in Argentina. They were over the muscle and the implants are too small, doesn't match her figure. So because she's tall, she's got the shoulders and hips, she's going to need better size implants. She wants to be D cup, and also the implants are over the muscle, and that doesn't look good. I'm gonna put the implants under the muscle to give her a more natural looking figure. So the combination of the two procedures, actually 3 procedures with the fat injection to the buttocks, is gonna make her bikini ready. So I'm very excited to start this procedure. Just got done with Melisa's liposuction. I sculptured her waist, abdomen, and her thighs. And the fat that got out from the liposuction, that was processed and injected back into her buttock area. So that made her butt look much better. It was injected in the upper butt area, so that gave her the Brazilian look. Next, gonna proceed to changing the breast implants. All right, we're about an hour from being done, and everything's going very well. Just got done with all Melisa's surgeries. I just finished the breast augmentation. She had implants before they were done in Argentina. They were too small over the muscle. So she wanted to be D-cup, change the implants, put them under the muscle, and they look fantastic. And also what was bothering her was the waist, the hips, the thighs. So all that, she had liposuction in that area. The fat was processed and re-injected into her upper butt. That will give her the butt lift look. And the combination of all these procedures is gonna make her look really hot for the summer season.
Hi, Melissa.
Hello.
How are you?
Great.
We're 6 weeks out. How are you feeling?
I feel fantastic.
Yeah?
Yeah.
And how's the healing process?
The healing is great. I already went to Cabo. Don't
I
worry.
see a little bit of a tanning action on you.
I followed your orders. I wasn't in the sun too much.
Okay. And so 6 weeks, this is the time where you see most of the bruising gone. The swelling, most of it should be gone. But still, there's still in the upcoming month, as the collagen builds up, you're gonna see the area that you had liposuction take more and more shape, tighten up more. And by this time, your implants have settled into place partially. Okay, so they still have ways to go. Okay, so 6 weeks is halfway. It takes like three to 6 months for the implants to be comfortable, natural looking where they need to be. All right, so I want to examine you. I'm gonna have you change into a gown, and I'll take a look at your scar.
Perfect.
Turn to the side. That's good. Put your arms out a little. Melissa's right on track for being 6 weeks out. She's healing really well. The results are already showing. But I want her to follow my instructions and keep on doing the massages so that the implants can settle into place and get the results that we're looking for.
I just had my post-op consultation with Dr. Kasabian, and he said that everything is going great with my healing process. Even though it's only been 6 weeks, I've already been able to wear a bikini. In the past, I've felt uncomfortable in a bikini, just embarrassed with certain areas of my body. And with these changes, I feel great now. I've had nothing but positive compliments from friends and family, and I couldn't feel better about myself. I'm so happy with the changes.
Melissa's concerns are not uncommon in my practice. She has had previous breast implants which she was unhappy with. That's because the implants were placed over the muscle, and you could see the contour of the implants and also rippling. I placed the implants under the muscle. That would give her a more natural look and also less rippling. And she also was not happy with the size. So we went up on the size a little bit. So the fullness and having the fact that it's under the muscle made it look more natural and more proportional looking. Additionally, she wasn't happy with her body contour, despite being on an exercise regimen and following a rigorous diet. I performed microliposuction on the waist, abdomen, and the thighs. And the fat that was harvested, injected it in her buttocks. And that gave her the silhouette that she was looking for. Sometimes I find in my practice that the smallest change makes the biggest difference.
I couldn't be happier with my results. From start to finish, the process was so easy. Dr. Kasabian and his staff were amazing, so patient, so compassionate. I'm already starting to feel so great about myself, and it's only been 6 weeks. I feel great physically, and I'm so excited about the future. I would definitely recommend anybody in my situation to come explore their options and see Dr. Kasabian and his staff.